I know there is a famous saying, it's not what you say, it's how you say it. But in respect to speaking to or commenting on social media to a person with chronic illness or incurable or invisible illness, it actually isn't what you're meaning and literally is what you're saying. So, this is a quick little depiction of some do's and don'ts of well intended comments that are absolutely meant with love, support, and positivity to encourage and celebrate with and support and show your love of all those feelings to someone that you care about in your life. However, unintentionally and unknowingly, they can actually cause frustration, sadness, internal conflict, or even inside be a little hurtful to hear.
Hi. Oh my gosh, you look so good. I'm so glad you're better.
You are but a fraction of yourself and the you once were and the you long to be, and perhaps feel like absolute poo on the inside and are really struggling to just fake it till you make it. While anyone would appreciate hearing that they look good, often people unknowingly make the assumption that looking good means you're better. Unfortunately, most of the time, that is not the case, especially in someone like myself that has something that is incurable and or has a high mortality rate. So you can instead please say, I'm so happy you're here. It's wonderful to see you.
You look great. You really look great.
Physical appearance, the outward image, and body image is a touchy subject and unfortunately part of the package for many people dealing with illness, medication side effects, surgery, and post surgical changes to their body. You are going through a lot on top of being sick with the mental and the emotional, and not always the outward appearance is going to reflect the internal battle or feelings or symptoms of what's going on the inside. Often with illness, appearances can be deceiving, and as they say, things are not always as they seem. Let me just touch on a couple ways to express that in regards to my journey and things that I have been through. When I was on high doses of steroids for almost a 2-year time in my 20s, I got the very common side effect, what you call the moon face, which is just that puffy, rounded face. As you all can see, my natural face is a little bit longer, my chin is a little bit pointier, and when I look back at pictures of myself from here down, my body was what it was and who I was, and then I had this puffy, chunky looking round face that was a side effect that I could do nothing about from medication that was vitally needed to not die and to survive and get healthy enough to be able to have surgery at a time that I was actually considered inoperable. More recently, I have experienced also changes in hair, skin, teeth, nails, and weight fluctuations, both with losses and gains, due to my condition and or medications. Last year, I was vomiting, not eating, and on IV tube feedings. And because I'm a mom and a wife and busy person, I was actually still being probably almost more active and physically exerting myself far more than I should have, just because life calls for it, motherhood calls it. You got to get things done, as we all do, sick or not. And I actually experienced a huge outward appearance change and weight gain on the scale, but it was all because of excess fluid infusions from blood transfusions, IVs for hydration, TPN for nutritional supplemental feedings, and even blood transfusion. To give you an example, between 2018 and 2019, I personally had over 10 blood transfusions. That is a lot of fluid swimming around one person's body. So I was not looking my best, I was not feeling my best, and I certainly wasn't feeling like amazing. When I looked in the mirror, I kind of was like trying to be okay with it, trying trying to present myself well and look nice, the times I could dress up and show up to whatever the event was. But obviously, I was not my best self. I was not presenting my best self, and I was going through a very big internal struggle because the outward appearance of what appeared to be excess weight gain was actually medical related. And people assume a weight gain or an increase in size means, oh, you must be eating, you must be healthy, you must be doing so good, you look so good, you look so great. However, weight gain and weight changes do not always mean you're getting better. I actually was fighting off death more times than I'd like to count, and had some very, very, very scary close calls and some really, really, really not great diagnoses that I was receiving at a time that I looked like I was gaining weight. And you would think, oh, she's doing well, she's doing better because she's gaining. But that actually was not the case. And so my advice to you well-intended, loving sweethearts who are just doing the best you can to be encouraging, and it is not your fault for not knowing. That is why I am making this video, to hopefully change that for future people to come. And I would be thrilled if somebody was able to watch this video and say, yes, what she said, yes, and be able to kind of have a voice and someone stick up for them and explain to their loved ones maybe what they're not ready to share or don't have the words to share. So when in doubt, leave the physical appearance out of it. And don't tell someone how great they look, because even though it is a kind compliment with good intent, it can actually trigger anger, frustration, and remind the person of how they're feeling and what they're suffering through with their body image and changes on top of their illness. So instead of saying, you look so great, you look so good, you look so great, or making an assumption about a change on the exterior of the person, can you please instead say, it is wonderful to be with you. It is so great to have you here. And be encouraging, be uplifting, but when in doubt, leave the physical attributes out of it, because you don't know how that's going to affect the other person.
Oh, you were doing so good. I'm sorry you're sick again.
This one is a comment I and many other people in my circumstances have probably heard quite a lot. Again, seeing is believing, and everybody shares what and how much they're comfortable sharing in whatever platform or way they choose to do it. Some people choose to keep it within themselves and their immediate family or household, or between themselves and their best friend or their parents or their spouse. Other people like to share with a larger audience from social media or larger groups or support groups, and there's no right or wrong way. You do whatever works for you. However, often when somebody hasn't shared the full package or somebody hasn't updated for a while with their situation, people assume no news is good news. Well, I haven't heard anything for a while. Well, you haven't posted anything about being sick in a while. And I think, and I hope I'm correct in assuming that it's kind of wishful thinking. Who wishes someone to suffer? Who wishes someone to be ill and going through a difficult time? So I myself even do that. Oh, I haven't heard from so-and-so for a while. I hope that means they're doing better. I hope that means that things are getting better. So please know that we absolutely appreciate your goodwill and your hopes for us and our success, or are overcoming the obstacles and struggles that we're facing medically. It is very much appreciated. And again, I can't stress enough that your good intentions are just heartfelt and touching, and we know that, and that's why people often just kind of let it go and don't say anything, because they don't want to confuse or hurt someone's feelings for correcting them or saying something about it that maybe it did bother them. But with this video, what I would like to remind people and ask people to do is, don't assume no news is good news. Don't assume that because you get an update or you see or hear from the person or someone in their closer circle that they're readmitted to the hospital, facing another surgery, starting a new round of treatments, got a new diagnosis, any of those. Don't say, oh, I'm sorry you're sick again, you were doing so good. because I guarantee you, I and many people like me internally, while they're smiling and just going, yeah, well, or just let it go and roll off their shoulder, inside you're like, was I? I missed that. Can you show me some footage? Can you let me know when I was doing good? Because as far as I remember, I still feel like caca and still am in this huge struggle and am dealing with a list of symptoms and doctor's appointments and struggling through my diagnosis and living with and around my condition. Where did I miss it? When was I doing good? So again, even though it's kind and well intended, putting words in someone's mouth and making an assumption about someone's process, struggles, or lack thereof can again kind of be a trigger, can be a hot button to push. So when in doubt, don't assume. You can either A, ask, well, had you been doing better? Let me know how you've been doing. And you can genuinely, especially if you're a good friend or a close family member and you have that confidence and trust with that person already established, you are in a position that you could ask carefully and respectively, well, I thought you had been doing better. Was that not the case? Or had you still been dealing with diagnosis or issues all along, something along those lines? And then lend them an ear and let them talk and listen. And that is so helpful to have someone genuinely care and just listen, because you feel like you're not alone when you have support. And when people genuinely show they're interested and care, it's just so touching and does so much for the spirit. So I would strongly recommend that if you're in the position with the person to do that. And then when in doubt, don't make an assumption. And instead of saying, oh, you were doing so good, sorry you're sick again, maybe just say, I'm so sorry to hear of these new diagnoses, or I'm very sorry to hear that you're still in the fight, or I was so hoping things had turned around for you. Once again, it's not what you're meaning with what you're saying. Just tweak the words and change the verbiage a little bit of how it's actually being said.
Oh, you can have salad, right? Want me to make you a salad?
Okay, so this last subject matter is actually very poignant in regards to IBD and GI conditions, because diet and food have a lot that play into that. So what a lot of people don't realize is, with their good, sweet intentions and trying to make an effort to include the person and be conscientious of their needs, often people instead make assumptions of what they would think is good for you or think you can have, as opposed to actually asking or letting you share with them what is good for you and what works for you. If I had $1 for every time I have been told, not asked, what I can eat at a given time, I would literally probably be a millionaire by now. So many people, oh, you can have chicken, right? I have chicken. Oh, but you can have white meat, just not dark meat, right? Oh, you eat soup, right? Well, you can have this kind of soup. If it's like lentil soup or chili or beans or has a lot of vegetables, that would be an obstruction in a spoonful, and I can't have it. So while I so appreciate people's efforts, it is a very touchy subject, because you don't want to hurt feelings, you don't want to offend anyone or make them feel bad for making an effort. So my suggestion for people who have someone sick in their circle when dealing with food and dietary needs would be simply ask them. Include. Who better to help you out than the patient themselves? So it can be so simple and error-proof if you just call, text, reach out to the person prior to the event. You don't let a guest dictate and plan your budget, your menu, your food choices, your theme, and we're not asking you to. Simply just shooting a little text or giving a little call and saying, I'm planning my party, or I'm planning the meal, I'm at the grocery store, I'm about to order from the caterer, whatever way you're providing food for your event or your meal that you're hosting. Just reach out to the person with the medical issue and simply say, what are you eating at this time? What is something that I could have for you that would be a good option? What is something that you're eating right now that's working well with you? This video has been educational and informative and can both serve to advocate for other patients and people with medical issues, as well as a resource for people who are loved ones of someone with a medical issue. And a special thank you to my mother for playing the featured role of the well-intended relative. So thank you, Mom. And until the next one, happy IBD Day 2020.